Hello, good afternoon. I'm Dr. Shayla Toombs Withers, family physician here at Essence of Health Wellness Clinic. Thank you for joining me today. In the month of June, men's health is highlighted, and especially this week as it is National Men's Health Week. As Father's Day is approaching soon, I wanted to share some health tips specifically to keep the men, the fathers, the sons, the brothers, and the uncles in our lives healthy. According to the Centers for Disease Control and Prevention, the CDC, the top five leading causes of death for American men are heart disease, cancer, unintentional injuries, chronic lower respiratory diseases, and stroke. Let's take a closer look at each of these causes of death and discuss prevention today. So, the number one cause of death, heart disease. Heart disease is actually the leading cause of death for both American men and women. 24% of all deaths in men was contributed to complications of heart disease, which includes heart defects, heart failure, and heart attacks. I encourage you to take a look at several of my previous videos to take a deeper dive into heart disease, why it's important, how it occurs, and how to prevent it. But some things you can do today to decrease your risk of heart disease are to one, decrease your intake of meat and dairy products. Animal based products contain cholesterol that increase buildup of harmful plaques into your blood vessels, which may eventually lead to blockage of these vessels and cause heart attacks, strokes, and heart disease. Two, exercise. Cardiovascular exercise like running, walking at a brisk pace, climbing stairs, swimming, cycling are all great ways to strengthen your heart muscle and to decrease your risk of heart disease. Three, reduce your stress. Do this by finding a relaxing activity that you truly enjoy. Sleep well, at least 7 hours of sleep per night. Meditate or practice yoga. Our second leading cause of death in American men is cancer. According to the CDC, the leading causes of cancer death in men are lung cancer, prostate cancer, and colorectal cancer. 90% of lung cancer is caused by cigarette smoking. If you are a cigarette smoker, quit today. Nicotine is highly addictive, and many people may require assistance with quitting. There are medications, nicotine replacement patches, gum, lozenges that may also help with cravings to help you quit. And then there are some alternative practices like acupuncture, meditation, and mindfulness that may be helpful in helping you to quit smoking. Prostate cancer is a slow growing cancer of the prostate gland. Symptoms usually present as urinary type symptoms, including difficulty urinating, frequent nighttime urination, difficulty achieving an erection, or pain with ejaculation. So, if you experience any of these symptoms, please see your doctor to determine if prostate screening is needed and if it would be beneficial to you. Colorectal cancer or colon cancer can present as changes in your bowel habits, blood in your stool, persistent unexplained abdominal discomfort. Screening is recommended for everyone at age 50 or at age 45 if you're African American, and maybe even earlier depending on your family history or your personal risk factors. Now, the third leading cause of death in American men is unintentional injuries. According to the CDC, unintentional injuries account for 7.6% of deaths in American men. These type of injuries include deaths related to falls, motor vehicle accidents, and unintentional poisoning like alcohol poisoning. So, men, when you're mowing the lawn, climbing a ladder at home to fix something on your honey-do list, taking on a new sport, be careful. Use a safety harness, drive slower, wear a helmet. Take these necessary safety precautions to reduce your risk of unintentional injuries. The fourth leading cause of death in American men is chronic lower respiratory disease. This category includes deaths related to COPD, emphysema, chronic bronchitis, asthma, and occupational lung disease from chemical and toxin exposures. As we previously discussed, don't smoke, and that includes cigarettes as well as cigars and vaping. If you currently smoke, quit today. If you do suffer from lung disease, consult with your doctor regarding inhaled and or oral medications that may be helpful to help improve your breathing. During this COVID-19 global pandemic, be sure to wear a mask and reduce your exposure to viral particles. If you work in a hazardous environment, get fitted and wear routinely a properly fitted respirator to reduce your risk of lung injury. The fifth leading cause of death in American men is stroke. Stroke kills the same number of men each year as prostate cancer and Alzheimer's disease combined. Stroke occurs when plaques block the blood vessels that lead to the brain, causing lack of oxygen and death to that portion of the brain which is affected. Stroke may also occur when a blood vessel in the brain ruptures, causing bleeding into the brain. I encourage you to view my video about stroke awareness that was presented just last month to take an even deeper dive into learning about strokes and stroke prevention. Important thing to remember is how to actually recognize the symptoms of stroke. Think of the acronym FAST, FAST. The F is for facial drooping or seeing asymmetry in the person's facial muscles. Arm weakness, if you ask a person to lift their arm with one arm being higher than the other. The S is for slurred speech. And the T is actually meaning time to call 911. Because as we learned last month in our previous video, that the longer a person waits while they're experiencing a stroke, the increased likelihood of more brain damage. So time is everything. So remember that acronym FAST. The men in our lives are indeed important to us. So, men, we do need you to take care of yourselves and to see your doctor routinely. Don't smoke. Eat more fruits and vegetables, less meat and dairy products. Exercise on multiple days a week. Consume alcohol in moderation, avoiding any more than 1 to 2 drinks per day. Reduce your stress level. Sleep well, and be mindful of potential environmental risks to reduce those unintentional injuries. Remember, the essence of health is in you. Thank you for joining me. I am Dr. Shayla Toombs Withers here at Essence of Health Wellness Clinic in Chattanooga, Tennessee. Previous videos are on my Facebook page at Essence of Health Wellness Clinic, as well as my YouTube page, which you can subscribe and follow at Essence of Health Wellness Clinic. And also be sure to find me on Instagram at Essence of Health Wellness Clinic. I also wanted to briefly touch on coronavirus, just from a perspective of that previously, just a few weeks ago, we as a country were doing really well with decreasing our numbers of coronavirus from many of the stay-at-home orders and the home self-quarantining. And now we are seeing these levels continuing to spike and rise again. So I wanted to just take a look at this. Because right now here in Tennessee, where I'm located, we have a total number of deaths of 441 people, and we've had over 28,000 confirmed positive cases of coronavirus. We're continuing to see the same trend as we did previously, where the highest number of cases of positive cases of coronavirus are actually in the age group of 21 to 50-ish. And so these people have the highest percentage of cases. However, when we look at the highest percentage of deaths, it's affecting our older individuals. So our 60 and up age group are more likely to die, even though they're having much fewer positive cases. So what this means is that our younger individuals need to continue to stay vigilant and mindful to not potentially spread viral disease onto others. What we also have learned through all of this is that many of our younger population don't show symptoms the same way as those people who are more frail or more um, sick or have higher risk factors or maybe elderly. Um, our younger individuals don't tend to show those same symptoms. So you may not necessarily know at that point in time that you are positive for coronavirus and that you may be spreading illness, which is why it's important for us to continue to remember to continue those safety precautions. Be sure to wear a facial mask covering your mouth and your nose when you're out in public. Try to avoid large crowds going to locations where there may be a large crowd of people, especially if you are not wearing a mask. Remember to wash your hands frequently or use some alcohol based hand sanitizer to keep your hands clean. And if you have potentially been exposed to coronavirus, whether that be while you were working or if you had potentially been in a large crowd, then be sure not to go around other potentially high risk individuals, those elderly individuals or individuals who may fall into those high risk categories, people with lung disease or heart disease, diabetes, pregnant women, or people with compromised immune systems. So, those are ways that we can all help to keep each other safe during this global pandemic. So, I will see if there are any live questions. And if not, always feel free to leave questions or any comments in the comment section of the video because I do go back and take a look at that and I'll be sure to answer any questions that may be asked. Hi, Diana. Thank you for joining me today and hope everyone have a great weekend. Take care.